Family medicine is like an interesting one. You can basically do a family medicine version of anything you want. So if you like internal medicine, you could do hospice. If you liked OB, you could do FMOB. But for me, I just knew I could not live without doing surgery. I wanted to be a main surgeon. I did not want to be a surgical assistant, but it's not the same responsibility and planning. And I actually really enjoy the post-op aspect of taking care of patients, like seeing how they recover on the ward, seeing them later in the clinic for follow-up. That's actually something I enjoy. And then when you're the surgical assist, you actually miss out on all that like really nice post-op part. There was just truly no option in family medicine for me to do what I wanted to do with my life. I didn't enjoy the work-life balance in family medicine. I know it's a huge sell. I did not enjoy it. I was actually pretty miserable because of the work-life balance. It was just like too much life, like not enough work for me personally. I actually love being on call. When you're on call, it's because you're able to offer knowledge plus skills that are essential to saving someone's life, which is why it's so important for you to be available instantly overnight to do things. And that's actually a very important reason why I really liked ENT, is that you have to deal with some airway emergencies, and so you could be needed urgently, but there are other things that are semi-urgent, so like a nosebleed that people are having trouble controlling and you don't want them to bleed out, for example. I really like that aspect. I think it brings me a lot of fulfillment in my career. I might not be saying that 30 years of my career at 3 a.m., doing an airway emergency that I've seen multiple times, or I have a family that I need to get home to. But right now, as a resident, I quite enjoy it. I think it's very fulfilling and interesting and exciting of a career to do on call and deal with emergencies. And really, I don't know, the hours I work here are much longer than I did on family medicine, but I feel much more fulfilled and the days pass by much faster. So somehow longer hours feel shorter. I also really enjoy doing work outside of work. So things like I've always loved doing research. And I asked around a lot when I was in family medicine, and no one was doing the research that I like to do. I want to do things like comparative trials, interventional studies. I was missing this really big thing that I was passionate about, and so to not be able to do that for the rest of my career was like really sad. So why ENT? The surgeries are really cool. In ENT, they're very varied, from very short to very long. So you could do total like huge head and neck cancer resections. You can do quick tonsillectomies. You can do quick septoplasties. Like you could do endoscopic. You could do open. You work everywhere. There's a lot of variety. You work in the ears, nose, throat, lots of stuff. As I mentioned, I really like the life-saving aspect of some of the care that you provide, particularly airway emergencies. With ENT care, I like that there's a lot of that you can scope. It's like awesome. Like you're doing like basically a procedure very, very commonly inside your own clinic. You could do, your own like fine needle biopsies, like very awesome. I think a very, very big draw for me was the personalities. From the start, I've always found all the ENTs that I work with very, very lovely people. And I think much more of a personality fit for myself compared to family medicine. I am like very type A. Like things need to be quite perfect. Things need to be pre-planned. I like to be very prepared, for example. I like to know what I'm getting into tomorrow. I like predictability. I actually really enjoy seeing the same things over and over and over again. I'm actually not that much of a variety person, have never been. So I think doing a specialty versus being a generalist is just much more suitable for me, because I like to see the same things over and over again, become more and more of an expert of it, really dive deep and know something well, as opposed to be a jack of all trades. As I mentioned, I'm a particular person. I would generally say family medicine people are just very chill. As I said, I am not chill. I would say definitely I'm a perfectionist, just through and through. And so I found that's much more of a fit with the preceptors that I've worked with so far. Like I would say most are much more of a perfectionist and want things done to a very, very high level of excellence in every aspect of patients' care. But I, like, work ethic is like one of my like hugest like values, and so I see this incredible work ethic in all my co-residents and all my preceptors. But like when I was a family medicine resident, I had a senior resident basically like dump their work on me so they could leave every day early at lunch and leave early for work, and so I was doing their work for them. Whereas I had a senior resident who was like, he says like, hey, I know you have to go to this mandatory surgical foundations teaching. I'm going to see this 3 a.m. consult on my own. I want you to get sleep because I can take post-call and you can't. Which I actually would have been happy to go see, but I just felt like I wasn't just being dumped on, I was being supported. And then we all like collectively try to, you know, if you are not done the work, you want to reduce work for the person coming on call, we'll stay later just to finish up everything and clean everything up so that we minimize the on-call person's work. That's just something I see universally done for everyone. Everyone tries to do as much as they can to reduce the next person's work. That work ethic, I think, is really incredible, and I see everyone just be incredibly diligent. Their notes are always just very good and thorough. And else, I guess another thing is like psychologically safer. The other day I was on with my senior resident. Someone who was calling us for a consult was like very rude. I had just like gotten so used to it, I didn't really like blink much. Afterwards he was like very upset actually for me. He was like, give me that name of that person, that's not appropriate. And he's like, I want to give you permission, if someone's talking to you like that, I want you to like speak up and tell them that's not okay. Like at that moment, like we don't create this culture where people treat you like that just because you're a junior resident. And I just felt like felt incredible, and like that, like this is how my senior resident is trying to take care of me, and I really want to make sure I'm doing that for my med students and my junior residents in the future, because like a patient, you know, was not being safe to the nurses. And universally, when we were talking about them in our ward rounds, our preceptor was saying like, you know, like 2 of our preceptors like, you know, if this patient is like continuously putting our nurses in unsafe condition, we will ask this patient to leave, because it's important to us the safety of all the staff that are involved. And so I just really, really like that culture of making sure that you are looking out for your nurses, you're looking out for your residents, you're making sure that like we enforce boundaries and rules that keep everybody safe.